Okay, welcome everyone. My name's Joss Colchester, and I'm with the SI London Hub team. Today I'm going to be your host. Okay, welcome everyone. And I'm going to be walking us through learning about leverage points today. We're going to be looking at the guide taken from our website. We're going to jump into all of that now. So this will be a 1-hour session, and it is being live streamed to YouTube. Thank you all for joining. Today, we're talking about this topic here, leverage points. As mentioned, it comes from our guide you'll find on our website on this very topic. We'll give you all the resources used today when we get to the end, both the canvas, the guide, and other links you might want to look into. I'm just collecting more people now. I'll give you a quick overview of what we'll be covering today. We're going to be working on our mirror board. Firstly, we'll get a presentation. I'll give a short presentation for maybe 20 minutes or so about this idea of leverage points, where it comes from, what it is, and how we might use it in the context of systems change. We'll then look at a couple of examples down here on this third section. On the fourth section, we'll be actually jumping into a canvas and working there on the mirror board. I will share with you now actually the link to the mirror board so that you can join me when you're ready. That one there should take you to the mirror board you see in front of me, and we'll be working here. So, and then finally, I'll share those resources with you and upcoming events and so on. So that's the plan for today. Let's actually start at the beginning here, right? So hopefully you're somewhat familiar with Miro. Just to get warmed up, let's do a little exercise here. I'd love to know what's your level of understanding to the idea of leverage points. What do you think it is? What do you think it's about? So grab a sticky here. If you're just a beginner, drag it up on the left here if you think you know quite a bit about this. Also, if you'd like to share what you think it's about, double click on the sticky and type in what you think leverage points are about there. So we'll just take a minute to do that whilst we let more people in. I'll share the link with you again. If you have any questions whilst we're going along, I'll pause intermittently, and you'll be able to post them in the chat there, or unmute yourself and ask the questions that you want to ask. It's just a short hour. We have a lot to cover, so we'll only take brief pauses for questions, but we'll do that as we go along. So for those not familiar with Miro, you can find your stickies up here on the left. You click there, you place your sticky down, and then you type away. That's all you'll need to do today. So let's quickly take a look here, what you come up with. Okay, so quite a spread, all the way from beginners to people who have something of a good understanding of this. So what do we have? What are leverage points about? Taking a map of the system and identifying where to find influence and how that connects to other parts of the system. Very good. That's pretty good. Places to have the most impact with interventions. Okay. To find areas to intervene, places and ways to intervene in a complex system. Okay. And over here, small parts of a system that, if affected, will change much of the rest of the system. Maximum impact from minimum energy. Places to intervene in the system, Donella Meadows, towards achieving desired behavior. Very good. Very good. So that's that. And of course, what we're talking about here is part of our series on the Systems Innovation Guide. So this is in the context of how do we change a system, how do we, as noted there, how do we influence it so as to change it in a particular direction? Some of you will have joined for previous sections where we talked about systems thinking. We looked at systems modeling and mapping and you know, We talked about the two loops models. We've looked at many different models. And we're in this stage now, actually, where we've already kind of thought about the system and we've already mapped it out. And now we're thinking about places to intervene. That's where we are. Okay, so let's jump straight in and talk about what this is. Let me just hide your cursors. Okay, so here we are. As many will know, this was introduced, the concept of leverage points by this lady, Donella Meadows, back in the 20th century. Quite a famous systems thinker, and in some ways the mother of systems change, or a kind of founding figure in this whole world of systems change and systems innovation. And you'll find here, actually at the end, I have that resource, the paper she wrote called About Leverage Points. You'll find also here an article on this topic. So this is sort of that. It's the idea. The idea of leverage points was introduced by Donella Meadows in a paper where she proposed a scale of places to intervene in the system that would result in varying degrees of change within the overall organization. She started with the insight that there are levers or places within a complex system where a small shift in one thing can produce big changes in everything. So that's it put very, very simply, very eloquently. Small shift in one thing can produce big changes in everything. So actually, here's the link here. You'll be able to find the paper she wrote on this subject if you want to follow that. So why leverage points? This is the guide you'll be able to find on the website. And look through all of it. We're just going to cover some of it at this stage. So when we stand outside the system observing it, as we were doing in previous sections, we were talking about systems analysis to try and understand the system or map the system out. At this stage, we're actually thinking about how to influence it and change it. But when we stand outside the system observing it, we can at least try to see the whole. But when we go to make interventions, we have to choose specific points in the system to intervene. There are countless places within a complex system to place yourself where what you will do will have almost zero effect. Worse than this, the points that look like they have the highest impact initially are often those with the lowest systemic effect. So you'll see in that paper there, Donella Meadows talks about it, and others also, that the places often that look like they would have the highest impact often not the ones that really would. She says these are counterintuitive, these places, and you really have to understand the system before you'll begin to find them. So systems change requires affecting the organization at high leverage points to address systemic issues. This approach is required on difficult problems since problem solvers can exert only a limited amount of force on a large system. If that force is applied at a lower instead of higher leverage point, it will be overcome by the forces of inertia, the dynamics existing in the system. So it's the idea that we have to be highly strategic in system change. We're often dealing with quite large, complex systems, and we don't have, massive amounts of resources. We have to be highly strategic, and that's the idea of leverage points. We're trying to find those places where we're going to have that highest impact. And this here is a big part of it, this idea of abstraction. And we'll be talking about the iceberg model here as a way to find these leverage points. So the nonlinear nature to complex systems means that their behavior is somewhat counterintuitive to us. Leverage points are likewise not intuitive. Our common sense leads us to search for them in the most obvious but superficial places. For example, if we were to take a large organization and look for the leverage points, we would likely look to the top of a hierarchy. Thinking if we could just change what the leader is doing, then this would affect everyone else. However, this person is often just an actor in the system who is responding to events. When if we want to change the system, we need to change the structure that the actors inhabit. So that's our kind of first level one thinking when it comes to changing systems at large. We often think, okay, find that person at the center, find the president, find the CEO, the person who has the power, and if we can affect them, then we'll affect the whole system. But that person is often just an executive in some sense, right? And they're just responding to the kind of events that they're experiencing. And they're not really the best place if you want to actually change a system. Where our intuition fails us is that we look for leverage points all at one level, the event level. So we'll talk about it now. Maybe you've heard of this idea of the iceberg model. We'll look at it now, but what we're saying here is when we go and talk to the CEO or the president or whoever it is, they're just operating on one level, this event level. The real points for system level influence are in abstraction. We have to remove the successive layers of detail before we can get to the foundations where the leverage really is. The iceberg model is designed to help us do just this. So this is the iceberg model. You've probably heard about it. Closely related to this concept of leverage points, because we're going to have to remove the successive layers of detail to get to something more fundamental in the system before we're going to find these leverage points. And the iceberg model is just one way of kind of structuring that, thinking about these different levels to the system and how we might get to something more fundamental, where if we made a small shift in that thing that was very fundamental, we could actually have larger effects on the whole system. Instead of if we just operate on the event level, we're going to, our resources will be wasted and not actually get the systems change outcomes we want. So the iceberg model is a model used in systems thinking to illustrate the various levels of abstraction to a situation or organization. From the observable events to underlying patterns that generate those events, to the supporting structure and ultimately the mental models used by an organization. Just as with an iceberg, a large percentage of what is going on in our world is hidden from view, and the iceberg model tries to make this explicit by depicting it as a series of layers that sit beneath the everyday observable world. So the idea of an iceberg is that only something like 20% is visible above the waterline. 80% or so of its mass, 90% of its mass is actually below the waterline, and you can't see that. And that's what we're getting at here. It's the idea that actually what we see in the world, this stuff above the waterline here, is just the events. The everyday events that we see going on in the world, those snapshots, you know, the price of oil going up, or, you know, a dictator falling, or whatever it is, an oil spill or something like this. It's just this stuff above the water that we see. And this is the event level. When really what's going on is stuff beneath that, underneath the water level, more fundamental stuff. And we need to get down to this. We need to get right down here before we're really going to find those leverage points. And the iceberg model helps to structure that thinking about that. It posits that there are 3 or 4 levels on which we can think about the system, from this observable actions and phenomena that we might call the event level, the stuff above the water, the stuff we see every day. Beneath that are the patterns and the trends over time that are creating those snapshots that we see on the event level. Beneath those is the structure, how the parts are interrelated to influence and create the patterns. And those structures are actually created, and the whole system is ultimately kind of created out of our mental models that support everything else in the system. How we're looking at that system, how we're understanding it, how we're understanding what we're doing in this system is really going to structure everything that follows from there. So that's the iceberg model, and it obviously relates to, as mentioned, leverage points. As the further down we go here, the higher the leverage we're going to get. We're operating up here, just pulling levers to try and make things, prevent certain things from happening, certain events from happening, or trying pushing and pulling things around on the event level. We're not going to get systems change. As we go further down here, when we come to structures and mental models, that's where we start to get the system change. When we start to influence things down here, it's going to bubble up here, because this is resting upon the structures are coming out of the mental models, the patterns are coming out of the structures and so forth. So you change something down here, it's going to lead to big changes further up as we go through. And that's leverage. Any questions on that so far? I'm going to clarify it now, but everybody generally happy with that idea? Okay, let's stay going. You're welcome to post them in the chat also if you have questions. So here we are. Let's just take a closer look at each one of these levels. So the event level, what is that exactly? Above the waterline are the events. Events are the marks in time where multiple variables are observed. They are what I saw and what just happened. Events are individual activities or facts about the state of things in the system. The 1-minute snapshot of current affairs that you might see in the evening is an example of an event within the iceberg, such as a new motorway being built. So those are the events, and beneath those are patterns over time. Patterns are the changes in variables that occur over time. They're the trends that we perceive taking place. If we look just below the waterline, we often start to see patterns or the reoccurrence of events. This might be, for example, reoccurring oil spills or one's computer periodically breaking down. Patterns are important to identify because they indicate an event is not an isolated incident. Okay, so structures are what comes below that. So structures support and create and influence the patterns we see. Structures can be understood as the rules of the game. They can be written or unwritten. They can be physical and visible or invisible. They're the rules, norms, policies, guidelines, power structures, distribution of resources, or informal ways of work that have been tacitly or explicitly institutionalized. The answer to the question, what might explain these patterns? So it's also about information flow, the way information flows within that system. And down here, the mental models. So the mental models used to perceive the world is ultimately what generates the structures, patterns, and events. Our mental models define the thinking that creates the structures that then manifest themselves as patterns or events. So mental models are people's deeply held assumptions and beliefs that ultimately drive behavior. There's typically not just one pattern or structure or mental model at play. There can be many of those. Okay, so that's just quickly iterating through those different levels so you have an understanding of what we're talking about on the event level, pattern, structure, and mental models. So here, going back to Donella Meadows' paper, you can see this is taken from that paper I mentioned, places to intervene in the system. And this is the analogy of the lever, right? And we know Archimedes, some 2,000 years ago, he did mathematics of levers, and he said, give me a lever long enough and I'll move the earth. And he was getting to that idea, the further out here you go, the greater your leverage, right? So if you're in here and you pull, you're gonna have to exert a lot of force to move something here. If you're further out, if you pull down there, you'll be able to move something much larger. And that's what we're getting at here. So as we go to the right here, we're getting to higher leverage points. So she's saying down here are the lowest ones, right? And the lowest one, she says, is quantitative parameters. So these are changing the event. This is the event level, right? So this maps on to the iceberg model here. So she's saying up here on the event, when we try and change these parameters, these numbers, that's the lowest leverage we can have, such as the number of products sold, the number of employees, so on and so forth. So these first three here, we'll go back to her illustration. These are all on the event level. It's the lowest level we can have. Buffer, stabilizers, material flows. Then she gets to kind of the patterns over time and trying to change those, right? The length of delays, the negative feedback and positive feedback. Here she's getting at the underlying structure of that organization or system, right? I mentioned information flows or changing the rules or altering the structure in some way. So these are getting higher leverage points. So when we talk about systems innovation and systems change, We're really on this end, these last 6 here. We're in the structures, changing information flows, changing rules, and changing mental models particularly. This is really where the high leverage is, right? Changing the goals of the system. When the system starts to understand what it's doing differently, its function and its purpose and its goals and so on, its objective, then it starts to really change. Like you get big changes there. Changes in mindset, right? Changes in what we're doing and why we're doing it and what this whole system is about really starts to change things. And changes in paradigm, which is the whole way of framing the system and the context, is going to change everything in it. It's the highest leverage. So a lot of what goes on in the world when we talk about change happens down here, trying to push things around, you know, putting a lot of money into something to try and change some variables or numbers or whatever it is. It's on this end of the spectrum. When we talk about systems change and leverage points, we're on this end of the spectrum, the last 6 there. Everybody happy with that concept? Any questions or comments there? Okay, all good. So here it is, yeah, mapped out onto the iceberg model. And you can see the kind of general correspondence, different levels of understanding to the system will lead to different, the potential for different leverage points coming out of that. So here we're just thinking about, okay, what can we do on those different levels, right? If we understand, if our understanding is on one of those levels, so the event level, then what will be our response if our understanding is just on that level? So if we look at events, the best we can do is react. Something happens and we fix it. This is typically our response the first time the event occurs. We do not shift our thinking in any way. We just act swiftly to fix the immediate problem, using pre-existing solutions that have worked in the past. For some superficial events, this approach can work well, but will clearly fail if an issue is more systemic, as we're merely dealing with the symptoms of the problem. Right? So it's kind of symptomatic problem. It's the bandage, putting a bandage on top of something and trying to, the quick fix. So here, beneath that, are the patterns. And when we understand patterns, so you can see the headers here are talking about, if we understand it on this level, the event level, this is what we're going to do. We're going to react to it. It's a quick reaction. If we understand it on the pattern level, right, the trends over time, what you can do then is start to plan and anticipate, right? If you start to see, if a government starts to see the housing market heating up and going into a bubble, and they recognize that pattern and have seen it before and they think it's going to happen, then they can plan and they can anticipate and they can start to take actions to change things in the future. So when we start to notice the pattern of those events, we have more options. We can anticipate what is going to happen and we can plan for it. When we start noticing patterns, we can begin to consider what is causing the same event to happen over and over again. So that's, as mentioned, a lot of where our traditional kind of management resides, right? Our reacting and anticipating and planning. Down here, we're getting more to kind of design and more systems change sort of stuff. So we're getting to the structure level. And when we understand structure, then we can start thinking about the pattern of organization and the design of it. So when we start to look at underlying structures, we begin to see where we can change what is happening. We are no longer at the mercy of the system. We can begin to identify the thinking and the mental models that are resulting in those structures taking the form they do. So much higher agency down here, and really starting to think about redesigning or changing the structure. And then ultimately in mental models, when we understand the mental models, then we can enable transformation by changing those mental models. So changing the model that an organization uses is the highest leverage point. It can lead to real transformation with the possibility of totally restructuring the system and overcoming even the greatest challenges. It's possible that events can change behavior, which changes elements, which change relations, functions, model, but it's often the other way around. It's often that to enable real transformation, systems change. It starts with changes in mental model, leading to changes in structures, and ultimately changes in patterns and outcomes in the system that we see. So there we have it. That's the idea of the iceberg model and leverage points. Hopefully you understand the idea at this stage. Let's just quickly take a look at some examples down here. So if we're talking about education, and we were trying to intervene in that system, right? We're trying to find leverage points. We're trying to change it in some way. So on the event level, we might make an app to help students study better. So that's going to lead to kind of incremental innovation, incremental improvements. If we went a bit down to the patterns, we looked at the kind of trends over time. We might invent a policy to tackle increased school dropouts. So we're starting to plan and anticipate and respond to trends over time. On the structural level, we might start thinking about changing the structure of education from teacher and school-centered to peer learning, so that it doesn't need to take place in school. It could take place almost anywhere. And it would be more peer-to-peer rather than teacher to student. You're actually changing the whole structure of the system at that stage with significant consequences. Ultimately, the mental model, rethinking education as a learner-centered, interest-driven process. And that would really change the whole system, right? If you really started to rethink education, shifting away from kind of teacher content, school-focused to learner-centered, interest-driven, more peer-to-peer and collaborative. That would result in systems change. So that's an example there in education. We have one here in social innovation, thinking about how to tackle social issues through this model. So on the event level, we might think about an app to help homeless people find a local food bank, something like this. Pattern level, a policy to tackle increasing homelessness through providing more shelters. Again, neither of those are really getting to systemic issues, are they? They're kind of patching over the problem, right? They're accepting that the structure of the system and they're working within that to try and fix it or patch over it. Down the structural level, might be changing the structure of support from centralized institutions to community peer-to-peer service providing, right? That would change the way we go about tackling this problem, the structure of it. Down the bottom, mental models, rethinking public value is something we all co-create in our society, right? And all having to take kind of responsibility for this thing, and the whole model for service provisioning changing there. So those are quick examples of the iceberg model and levels that we might intervene in a complex system with a wicked problem. Here, let's jump into the canvas now. If you could please join me, I'll share the link again. And you can join me when you're ready. Okay, so there's a link. We're going to look now at the wicked problem of healthcare in developing economies. It's a challenge for many developing economies, particularly during COVID. We had big problems with the kind of industrial age, centralized healthcare systems we have, and the big changes in the world too, due to chronic diseases and so forth. Let's think about this problem on its different levels, right? Particularly the United States is a good example. It's becoming excessively expensive to go on with that system. So let's grab our stickies and think about this on the symptomatic event level. What might we do about our healthcare systems and this challenge of providing healthcare when it's becoming excessively expensive on the event level? How would we respond if we were doing it on that level? Let's just take a few minutes to post up our ideas on this level, and then we'll move on. Okay, let's take a look at what we have here, talking about the event level to this problem of providing healthcare for an aging population of chronic diseases, which is not really well set up for. It could become excessively expensive for an aging population with a new set of kind of lifelong challenges where they need care continuously almost. So yeah, what do we have here? Linking doctor's information, linking doctor's information. That might get a bit more to the kind of structural level when we talk about information flows and structure of information. Expanding the structure of the hospital, larger rooms. Yeah, you can see that's kind of a quantitative thing, isn't it? Food labels, healthcare education. I'd say that healthcare education might be, depends on what kind of education, but that might be getting to the kind of mental models level because we're trying to change people's thinking. So an exercise app, potentially, yep. Generic drugs. Drugs are definitely a good example, aren't they, of trying to patch over healthcare problems. Government subsidizes healthcare. Yeah, require self-care training, prioritize more ill, distribution of medication, hire more staff. Yeah, these would be kind of symptomatic responses. We've got a problem, throw more resources at it. Reduce waste time, data analysis of infections, digitization, subsidize poor people, create efficiencies. Yeah, how do we improve what we already have without thinking about the actual structure of that system? Okay, let's stay going, move on to the next section, talking here about patterns. Let's take a couple of minutes to post up here. How would we respond to these changes over time if we're taking a kind of planning approach to it? And patterns are the changes in variables that occur over a period of time. They're the trends that we perceive. How would we respond if we're taking this kind of planning approach to it? If we look back at what Donella Meadows was saying up here about the different, this leverage point, we're now here on patterns. The length of delays relative to the rate of the system, the strength of negative feedback, the gain around driving positive feedback. Yeah, so these are different flows in the system and how it's changing over time. Let's just spend a couple of minutes there. So Danielle, do you want to read out your question you have here? You can unmute yourself if you're with us.
Hi. So, yeah, as I was saying, suppose an organization is trying to rethink the problem. Perhaps the strategies that they used before were ineffective. And so now taking this systems change, systems innovation, type of approach now and trying to find the best leverage points. How will they go about first identifying the problem so that they can see these different things more clearly? Because if they don't have a clear understanding of what the problem is, then how would they then be able to figure out the best leverage point?
Yeah, so what we're doing here is really part of a broader process, Danielle. This is one stage in that, as mentioned. Normally you would start with a mapping exercise. to really map out the different factors and actors in this system. Actually, you may, I mean, we, in our process, we start a step before that in trying to think about the problem actually from the system's perspective, because quite often when what we think is the problem is not really the problem, right? We're actually looking at it from a particular kind of, often a kind of reductionist view of the problem, and we need to kind of learn a bit about systems and start to think about this in a more holistic way from a systems perspective, and then do the systems mapping, map out the system, the different factors and so forth. We did this in previous sessions. And then from that map, you'll get as people have commented at the beginning here, you'd see the different factors and interrelationships and so forth. And then you could start thinking about the leverage points. You wouldn't really jump straight into where we are now. You'd need more mapping exercise for this, yeah.
Okay, I understand that now. So this is just a part of that process.
Yeah.
That identifying the problem piece is something that should have happened before you got to this point.
Yeah. If you take a look at the guides on the website, you'd see they're kind of structured, as I just mentioned. You'd find ones on mapping before you start in on this. Yeah.
Okay, thanks. Appreciate it.
Okay, any other questions before we move on, or everyone happy? Okay. So we have one other. My focus is on suicide prevention. Is there some template and other people interested in sharing ideas around how to apply systems thinking to community strategies? You might post that in our community site, Michelle. See if there are others who are interested. Okay, what have we come up with here? We're looking at the pattern level, thinking about planning and so forth. So stock medication, yeah. Training programs for staff capacity, yeah. So these would be quite typical kind of good management approaches, right? People who understand what's going on, at least the changes in the variables and the dynamics that are playing out over time, starting to see that, you know, there's less of this or there's more of that, there's too much of this or there's not enough of that. How are we going to intervene to change these flows in the system over time? So provide 40 pluses with free healthcare advice. Drug price increase, yeah, you can see trying to change it, and again, a quantitative variable, a particular thing in the system, right? The drug price and changing the variables associated with that. Age group, respective measures, subsidies, drug policy. Examine data related to crimes against elderly population. Examine elderly care population and look at trends in community connection to balance lack of caregiving. Okay. Yeah, I mean, that's a good example, because there's going to be, you're going to see that there's not enough people to look after your elderly people, and you're going to start thinking, how can we get more of these healthcare people? Maybe we're taking, actually in Germany, they're having big problems finding nurses and so forth. So they're taking them from abroad, Eastern Europe and so forth. So that would be a kind of one approach if you're just looking at the problem on this level, right? And not actually looking at the underlying cause or underlying system structure and so on. So $150 reward for participation in exercise program. Okay, identify roles and responsibilities, workout sessions, process mapping, survey staff. Okay, so those are, yeah, the two levels that we'd normally kind of look at the system on in management approaches. These are the two levels where we're really getting to systems change. We're starting to look here at the underlying structure of the system and ask, how might we change that? And from that, get the emergence of different patterns and different outcomes in the system. So the structures support, create, and influence the patterns we see. These are the rules of the game. When we start to look at the underlying structures, we begin to see where we can change what is happening. How can we influence information flows, rules, and other structures, the way this system is organized? For example, you know, a lot of these systems end up being quite centralized, like a hospital. It's kind of centralized way of doing healthcare. That's a structure, it's a pattern. People flow into the center to get medication there. Let's think about this challenge of providing healthcare, developing a healthcare system for a mass population in a world of chronic diseases and an aging population, and think about how we would intervene to respond to that on the structural level. What would need to change there? Let's take a couple of minutes to do that. Okay, let's take a look at what we've come up with here. Anybody want to suggest something, unmute themselves, tell us what they think might be a structural response to this challenge?
In the past, I've heard a lot of ailments come from a lack of connection with local community and a reliance on the medical system. So looking at more ways to do preventative care in the day-to-day lives of people might provide opportunities to prevent the illnesses from overwhelming the system. So looking at things like elderly fitness clubs and organized groups that help pair people with different capabilities to maybe support each other with different medical needs that are on the day-to-day business, right? So making sure people take pills on time and stuff like that. Connection with ideas like adopted families where, you know, maybe you're not blood related, but you can build that sense of care and community. again, to help ensure people are taking care of themselves, so it doesn't become a
Great. Great. I think what you're getting at there too is kind of the idea of context, isn't it? It's like here on this level, we're not really looking at the context within which these people exist and that the problem is emerging out of. We're just trying to fix the problem here. What you're talking about is what is the context that these people exist in, and do they have what they need, all the things around them and so forth, to actually not solve the problem, but actually try and prevent it from arising in the beginning, prevent them having to go to old people's home or prevent them having to go to hospitals to be looked after, to actually maybe have that function in the system already. So I think you can, in previous section, we talked about systems innovation as not an approach for fixing problems, but an approach for dissolving problems, right? So a lot of what we do in the linear worlds, traditional reductionist thinking is trying to fix problems. There's a problem and we've got to fix it, right? These elderly people need to be taken care of, so let's put them in elderly care homes or put them in hospital if they're sick. Here we're saying, let's think about the system, the context within which this problem emerges, and let's try and change that context in some way so this problem doesn't emerge, so that we don't have, a lot of money being needed to support elderly people. How could they actually be taken care of at home or take care of themselves, so on and so forth, looking at the context. So we're really getting to the system and the context within which this problem exists to try and dissolve it instead of solving it. Okay, anybody else want to add anything here? Any other ideas? Okay,
I was thinking also along those lines. I put it in the chat, but in regards to preventative health care or preventative care, how to integrate it within the education system. Since there's, what I see at least is a lot of focus on adults, but how do we prevent them from getting to the point of being like unhealthy, sickly, or misinformed, uninformed adults, and maybe integrating in some way, either through the structures of the education system, or curriculum, other structures like curriculum, or again, like their lunches or what have you, or offering certain classes, even from, pre-K all the way up, how we can utilize preventative care.
Great, thank you. Fitzroy, you have your hand up.
Yeah, thank you very much. I was going to say, because I was thinking about some of the archetypes, and fixes that fail is one of those. And so, what we are seeing is how a tendency, like you said, is to rush into solutions that turn out to be problems in themselves. And so as the individual who was just speaking before, I think it may have been Danielle, I can't see, I'm on my phone, is pointing out, how do we get ahead of the problem is a better place for us to go, rather than thinking about how can we solve it, how can we get ahead of it.
Well, how do we not create it in the first place? Because part of the realization about wicked problems is that almost all of them, we create them. We create our healthcare system, right? We create obesity, we create corruption, we created climate change, so all of these are created by us. So part of it is saying we can actually dissolve the problem. We can actually not try and fix it, but get rid of it, like not make it happen in the first place by having better systems. Okay, Randy, do you want to add something?
Yeah, thanks. The point I was going to make is in the interest of proactivity, to look at healthcare as more than just doctors and hospitals, but the environmental contaminants that lead to cancers, air quality that leads to asthma and other things. So this may be more of a mental model, but it's part of the structure of the healthcare system would be not only to think of it as hospitals and the classic healthcare, but what about taking care of the environment and removing or stopping the contribution of things that are creating health issues?
Yeah, so we're getting to a more kind of holistic perspective on this, aren't we? No longer just kind of sick people with symptoms that need to be fixed by doctors in hospitals, but actually the whole context, all the different factors, a kind of holistic view of it, of the system, of its structure, and so forth, so that we can work on that level across all those different dimensions, so this problem hopefully doesn't emerge, or the system is healthy and resilient and functioning in its structure and so forth, so it can kind of look after itself in some sense. Okay, so let's stay going for the sake of time. Those were structural features. We're now going to look at mental models and paradigms. So really interesting, this one. What can we change about our actual way of thinking about this system that would change the whole paradigm, the whole dynamic that's going on here? Is there something we could change on this level? How are we actually thinking about healthcare at the moment, and what could be an alternative way of doing that would really change things here? How is our thinking leading to the problems that we're creating here? That's an interesting question to ask. And is there a different way of thinking that can lead to very different outcomes that would no longer result in these wicked problems? Let's take just 2-3 minutes to post up there. Okay, let's take a little look at what we have here. So talking about mental models, someone was asking there in the chat, can they have an example of a mental model? I'd say in this context of healthcare, we have this kind of conception, well, people often say it's not healthcare, it's sickness prevention, isn't it? We don't really, healthcare system isn't really so much concerned with kind of health and well-being. It's a lot more concerned with sickness. It's kind of focused on fixing people who are sick. And that's kind of a framing, that's kind of a paradigm. We could come up with a very different one, which is more about wellness or well-being and taking care of that from the beginning instead of fixing the problems at the end. Okay, anybody want to share something here around mental models? Any ideas? distribute the sense of health responsibility to the community. Yeah, we kind of seem to defer this to institutions and doctors and hospitals and pharmaceutical companies that are going to fix us when we have problems. Early education, health and behavior, awareness campaign, distal effects of behavior. National health.
Can I just try and distinguish between those two? I wrote those early education and awareness campaigns, distal effects. I was just thinking that you can teach kids at school about what they can do that is, in terms of behavior that'll affect their health. But the other one is about distal effects, meaning that people should be aware of what little things that they do that has a long-term effect. In terms of like a short walk or a small bit of exercise regularly that has an effect that's a positive one that they will get later, much later. It's like an investment kind of thing.
Yeah, and it's kind of the way healthcare is going, isn't it? The way we're tracking, almost everything we do, how many steps we've done today and how much sleep we got last night. And we're starting to get much more information on food about what it's doing to us. And, cigarettes are a good example. They didn't even tell us 40 years ago about what happened when you smoke. Now you see it, on the packet and so forth. So I think it's happening already, and it gets that holistic thing. We're actually starting in almost everything we do, our different environments, starting to see in activities what are the consequences of that. And I think that's ultimately what would lead to a real paradigm shift in healthcare, actually accounting for and incentivizing us to take the right actions in all these things we do in our lives and understand the consequences and so forth. Complete transparency in supply chain, prioritize quality of life over quantity of life ethically and legally. Learn from other countries rather than looking within the bubble. Mental health is real. Prediction is real. Yeah, so a lot of our healthcare system seems to be kind of focused on physical ailments, and someone put it down here, a separation between mind and body. We know that's kind of part of the modern reductionist view of the world. Local and global health outcomes are connected. Change the goal from health care to wellness care. Healthcare is a human right. Question why there's even a healthcare industry to begin with, from attending the sick to keeping people healthy. Yeah, that would be a paradigm shift, right? That kind of gets to a goal, doesn't it? Remember Donella Meadows had there, changing the goals of the system changes a lot of things. And the way that people, when you change the goals, that starts to change the way that people, the objectives and what people are getting accounting for and assessing for and getting incentivized for. Moving from symptoms to healthcare to holistic care. Yeah, money should not be a barrier to health of life. Health is not just individual responsibility. Yeah, a collective thing, right? We've learned a bit about that during the pandemic, but before we really thought about this kind of reductionist thing. It's every individual for themselves. Pandemic, we saw it's not really the case. What I do affects other people. This is actually a group and societal level thing also. Okay, so we've run over time. Let's leave it there for now. Well done, everyone. Hopefully from doing that exercise, you got an experience of what we're talking about here, the different levels to the iceberg model, and what they mean, and what they mean for our interventions and how we might find leverage on those different levels. Obviously, the higher ones with lower leverage, and as we go down and as we understand the system structure and the mental models and so forth, we can have potentially much higher leverage and potentially actually change the system. Okay, so we wrap up there. Just a few little notes down here. As mentioned, the resources used today. This is the guide here. You'll find it on our website. Click on the link there. This is the canvas we just used. You can find it there. They're both freely available for you to reuse. Our next event is coming up next week. It's a co-creation on participatory cities. You can find that there. And someone was asking about the recordings. You can find them here on our YouTube. You'll find today's event is recorded there, and all the previous ones. We've now done about maybe 12 of these sessions working through the guides, and you'll find them all there. And you'll get updates on our community channel, LinkedIn, Twitter, and so on. So that's that. Thank you very much for joining, everyone. Hopefully you take away a much better understanding of leverage points, and I hope to see you again at next week's event or next training session, which will be in a month from now. We wrap up there. If you'd like to give some feedback, that'd be great. Grab a little sticky down here, put it wherever you think what you got out of today's session. Write up anything you'd like to put there in terms of feedback, so we can try and improve things for the next session.
Josh,
Great.
Is it possible for me to ask you a quick question?
Sure.
How does design thinking fit into this? As I'm myself learning about all this kind of stuff, like I know that it is a thing that like certain corporations, organizations, and things like that are utilizing, but how does that fit?
Yeah, it's a slightly different question, Danielle. Popular question. It would you could say the whole design thing would kind of come further down the line, right? We're understanding the system at this stage or in the previous stage. At this stage, we're thinking about intervention points. In future stages, we'd think about how do we actually design interventions, right? And design thinking is a kind of user-centered approach to that, which is great. But then there's also kind of systems design, which is thinking more broadly about the system also, and the overall kind of platform, the kind of how you need to interrelate a number of different things. So the whole design area would come further down the line, and user-centered design would be part of that. We have lots of discussions about that on our community site. So if you dropped a message there, I'm sure people will reply to you. Okay.
Okay. Thank you.
You're welcome. Let's leave it there for now, and hope to see you again.